Hello everyone. Today, we're exploring the medication known as Zontivity, with its generic name being vorapaxar. As always, this discussion is for educational purposes. For any health-related concerns or questions, please consult a medical professional. Zontivity, or vorapaxar, belongs to the drug class of protease-activated receptor 1 antagonists. Its primary function is to prevent platelets in the blood from sticking together, thereby reducing the risk of blood clots. Such clots can arise due to certain heart or blood vessel conditions. Zontivity is primarily prescribed to decrease the risk of stroke or severe heart issues in individuals who have experienced a heart attack or a blood vessel disorder affecting circulation in the arms and legs. It's also sometimes used in combination with aspirin or clopidogrel, Plavix. Zontivity is not suitable for everyone. It should not be used if you have active bleeding, stomach or intestinal bleeding, a head injury, or if you have a history of stroke, including mini-stroke, bleeding in your brain, or increased pressure inside the skull. The medication can increase your risk of bleeding, which can be severe or even life-threatening. If you notice symptoms like bloody or tarry stools, red or brown urine, any uncontrolled bleeding, or if you cough up blood or vomit that resembles coffee grounds, seek medical attention immediately. Before starting Zontivity, ensure you are not allergic to vorapaxar. It's crucial to inform your doctor if you have any of the following conditions or histories: active bleeding, stomach or intestinal bleeding, head injury, stroke, mini-stroke, or bleeding in the brain. The risk of severe or life-threatening bleeding can increase if you have a bleeding or blood clotting disorder, are an older adult, are underweight, have liver or kidney disease, take certain medications, or have recently undergone specific heart procedures. If you're pregnant or breastfeeding, consult your healthcare provider before taking Zontivity. Zontivity is typically taken once daily, with or without food. If you're undergoing surgery or dental work, inform the surgeon or dentist beforehand, as you might need to stop the medication temporarily to prevent excessive bleeding. Do not stop taking Zontivity suddenly, as it can worsen your condition. Even after discontinuing, its effects can last in your body for up to 4 weeks. The usual adult dose for thromboembolic disorder and peripheral arterial disease is 2.08 mg orally once a day. It can be taken with or without food and is sometimes used alongside aspirin or clopidogrel, Plavix. Always follow your doctor's recommendations regarding dosage. Always adhere to your doctor's guidelines about any dietary, beverage, or activity restrictions while on Zontivity. Like all medications, Zontivity can cause side effects. Some of these include easy bruising or bleeding, anemia, depression, and rash. In rare cases, symptoms like lightheadedness, signs of a stroke, or severe bleeding can occur. If you experience any unusual symptoms, consult your doctor immediately. Zontivity can interact with other medications. It's crucial to inform your healthcare provider about all the medications, supplements, and herbal products you're currently taking to prevent any adverse interactions. While on Zontivity, follow your doctor's advice regarding any restrictions on food, beverages, or activities. Many might question the age restrictions for Zontivity. It's always best to consult with a healthcare provider for any specific queries related to this medication. That concludes our overview of Zontivity. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.